Parkinson's disease is a progressive neurodegenerative disorder that affects both the central as well as the autonomic nervous system, causing mainly movement control issues. Originally, there is a motor circuit between the midbrain, the basal ganglia, and the cortex of the brain, regulating voluntary movements using dopamine. This is called the nigrostriatal pathway. In Parkinson's, dopamine depletion in the substantia nigra and locus ceruleus affects the pathway. As a result, patients exhibit symptoms such as tremor, bradykinesia, and rigidity. The question is, why are the neurons dying in the first place? Alpha-synuclein is a protein that normally binds to a neuron's cell membrane, affecting calcium regulation. When a large amount of that protein accumulates in the cell, it creates clusters, which then form fibrils. In the end, the fibrils bind together, causing Lewy bodies to form. Lewy bodies are toxic for the nerves. Alpha-synuclein seeds can also spread from cell to cell, promoting Lewy body synthesis and causing the dopaminergic network to die. In the case of hereditary Parkinson's, mutations in genes encoding alpha-synuclein cause Lewy body formation. The most common form of Parkinson's, however, the sporadic one, may be better explained by the Braak hypothesis. The Braak hypothesis suggests that Lewy bodies are not actually created in the brain. They first originate in the gastrointestinal nervous system. The theory describes that a pathogen enters the body through the nasal cavity. It is then swallowed and eventually reaches the gut. This causes Lewy bodies to form in the vagus and olfactory nerves. Much like a prion disease, Lewy bodies ascend to the brain, leading to motor symptoms. This theory might be able to describe symptoms such as hyposmia, constipation, and urinary incontinence, which precede those of movement in some patients. Management of the symptoms includes dopamine repletion medication and even surgical options in some cases. As a summary, Parkinson's disease is caused by dopaminergic neuronal loss inside the brain. Misfolded alpha-synuclein accumulates, causing the formation of Lewy bodies and the eventual death of the neurons. Mutations in the genes translating to alpha-synuclein can cause hereditary Parkinson's. The prion hypothesis suggests the origination of Lewy bodies in the GI system or olfactory bud before finally reaching the brain, explaining some of the sporadic cases of the disease. There are still many things to discover about how this disease occurs and possibly arrest its progression.